Welcome to Infertility and Me Podcast, a show that amplifies diverse stories about the struggles of infertility and fertility in a safe space. Our goal is to normalize fertility stories that validate, give hope, and create a community where no one is left silently suffering.
Thank you guys so much for being here to Infertility and Me Podcast. Welcome, you guys. You guys, we have a special episode, bonus episode for you today with Dr. Bar-Chama and Dr. Barrett Cowan. These two doctors are doing phenomenal work within the fertility community and reproductive care as a whole. I am not going to make you guys wait very long for this interview and discussion today about male factor infertility and how Dr. Bar-Chama and Dr. Cowan are both trying to change the game, I should say, and present a better way and opportunity for other facilities and clinics to collaborate with them on their Project AIM. Now, Project AIM is a collaborative effort with fertility clinics and OBGYNs to help assess and diagnose male factor infertility with couples who are trying to conceive. Now, individually, Dr. Cohen and Dr. Barrett all both have their own practices. And so they will tell you a little bit about that in this episode. Dr. Cohen is a chief medical officer of Posterity Health. He has been specializing in treating men with infertility for over 20 years. He received his medical degree with honors and completed his urology residency and fellowship at Stanford University of Medicine. He's published multiple scientific articles and authored a chapter on a commonly read fertility book. He is a member of the American Urologic Association, American Society for Reproductive Medicine, the Society for the Study of Male Reproduction, and the Society for Male Reproduction and Urology. And then Dr. Natan Bar-Chama is the director of the Center of Male Reproductive Health, or widely known as RMA, of New York. He is a board certified urologist and a male infertility specialist. Following his urology residence at the Albert Einstein College of Medicine, he was awarded the New York Academy of Medicine FC Valentine Fellowship and subspecialized in male reproductive medicine and surgery at the Baylor College of Medicine in Houston, Texas. For the last 20 years, Dr. Bar-Chama has been the director of male reproductive medicine and surgery, is on faculty in both the Department of Urology and Obstetrics and Gynecology and Reproductive Science at the Econ School of Medicine at Mount Sinai. I hope I didn't mess that school's name up too much. I haven't heard anybody say that name in a while. So, um, Dr. Bahama's practice is exclusively dedicated to the fields of male infertility and sexual medicine, and he has published extensively and lectured throughout the world in these areas. He is currently on the board of directors and slated to be president of the Society for Male Reproduction and Urology, is past president of the Society for the Study of Male Reproduction, and serves on the board of directors of the patient advocacy organization Path to Parenthood. So on March 14th, 2022, Posterity Health, which is Dr. Cohen's practice, Project AIM. Project AIM stands for Access to Care inclusive of the male partner. Project provides men with at-home testing and access to male fertility specialists through leading OBGYNs across the country, beginning with RMA of New York, widely acknowledged as a national and international leader in the state of art reproductive medicine. Project AIM will create a unified fertility journey experience with obstetricians and gynecologists offering patients options to conveniently obtain a semen analysis and engage with Posterity Health's novel telehealth platform that will provide them with male infertility expertise and urologists. Following the initial launch with RMA of New York, Posterity Health we'll begin rolling out Project AIM in other states to make accessing male fertility care more easily accessible to all. Project's AIM goal and benefits are supporting the couple through their journey to parenthood by promoting the coordinated evaluation of both parties, exploring the root causes of male infertility, and possibly detecting underlying men's health conditions, embracing the LGBTQIA community with inclusive family building services. New Yorkers looking to conceive with will have the opportunity to better navigate a fertility journey together through an initiative called Project AIM. So that's the basis of Project AIM, is to create a collaborative effort with doctors and clinics all over the nation and hopefully globally at some point, if not already by the time that this episode releases. And that is to help males get to the root causes of their infertility. And when well, you'll hear in this episode Dr. Barrett Cowan explains that sometimes there are instances where the female has unexplained infertility, but then when they do their analysis and they do their telehealth calls, they get to the root cause of the issue with the couple and they find that there's a male infertility factor issue where the male's sperm may not be of the best quality, and some simple lifestyle changes greatly and vastly increase the chances of a successful pregnancy and a viable pregnancy and an overall healthy baby and lifestyle. So we'll get into a lot of those things in this episode. Dr. Barrett Cohen and Dr. Natan Bar-Chama both speak eloquently about the various reasons for male factor infertility, how their passion is creating a holistic care program that services both the male and the female and not just putting the weight and the burden on the female, as we see in marketing efforts in fertility and reproductive care industry. And it's always pushed and aimed at the woman because society and overall in history, we see that bearing the children has always been the work of the mother or the woman in the situation. And then they're also really adamant about helping to expand families and create ways in which LGBTQIA community members can greatly increase their chances for a successful and viable pregnancy as well. And so we get into a lot of those things. You'll learn and educate and be reminded of many things that go into creating or expanding families and including the male partner. And so I think that you guys will really enjoy this episode. Make sure that you pass it along to your friends, your loved ones in the community, in and out of the community, I should say, if they're having troubles trying to conceive and male factor may be an issue, or if you would just like to get a better understanding of male factor issues and ways in which you can get your partner tested, please reach out to Project AIM as well as their individual practices of Posterity Health, and so that you can get comprehensive plans and treatments and telehealth. And what they also speak about is how easy it is to to get the diagnoses for men. There's specific, very straightforward tests that can be done to get to the root causes. And with this Project AIM, they hope to be able to collect more data and more research, so that they can advance the technology needed to treat male factor infertility. And so we'll be back in just a moment, you guys, with Dr. Cohen and Dr. Bar-Chama. Welcome back, you guys, to Infertility and Me Podcast. I have Dr. Barrett Cohen and Dr. Natan Bar-Chama on the line today, speaking about male factor infertility, as I stated in the intro, as well as their new initiative in collaboration with Project AIM. So, thank you, gentlemen, so much for being on the show and taking the time out of your busy, busy schedules. I appreciate you.
Great to be here.
Thank, thank you for having us.
Yes, yes, it's my absolute pleasure. My pleasure, my pleasure, my pleasure. And so let's start, I guess, with why you guys got into male reproductive care and in the reproductive industry, in general, actually. So I guess Dr. Cohen or Doc, I don't know which one of you guys want to go first and
Yeah,
give us
well,
a.
I'll take that one on first. So, yeah, first of all, thanks for having us. We're just really delighted to be here. Reproductive urology is actually a specialty that doesn't have very many people in it. There's probably just over 200 people in the country who do this. And so we're really there are very few of us, and so we're kind of a rare species to begin with. But what I found is that it's tremendously rewarding in this to do this, to help people achieve their goal of having a healthy child. And quite frankly, there's such a huge need for people like Natan and myself to be out there helping people.
Many of us have gone into the field of medicine to deal with disease, and I think it's a good starting point to identify that infertility is not a psychological, it is actually a medical disease. And once we accept that structure and that framework, diagnosing and is something that we encourage and want to expedite through this Project AIM initiative.
I get it a lot, but are you seeing that male fertility is becoming more of an issue as you've been in the practice for many, many years now, since the beginning of your careers? Are you finding that it's more common now than it, say, was 20 years ago?
Yeah, well, interestingly, the infertility as a whole, and I really see it as a couples issue, not as a male or female issue, but as a couples issue, it's very, very common. Traditionally, 1 in 8 couples who are trying to conceive have difficulty, and the woman's over 35, it's actually 1 in 6, so it's really quite common. Traditionally, in most traditional fertility centers, for example, fertility centers have been, in the past, have largely been female fertility centers. And so it's really great to be able to offer what we call collaborative couples care.
And I think I would just add to that as well, that while infertility is a contribution by the male, is often underappreciated. About 20% of the time when a couple faces infertility due to the male, and in another 20% of the time, it's a combination of the two. So this notion of segmenting and first dealing with the female and then assessing the male, that is not efficient, or actually the current philosophy. The scientific community in guidelines set up just a year ago, that both the male and female should undergo an evaluation in parallel. And that's probably the most important send via this, this. We need to have both evaluated at the same time, for us not to waste valuable time and to create an environment where we can contribute most effectively.
Yeah, and being someone in the space and speaking to fertility patients all the time, that's why I really like what you guys are doing, and really seeing it being a trending or the trendsetter of care when it comes to couples and treating them as a whole and as a collective. I was just speaking to someone, and she said that it was maybe a year into getting reproductive assistance before they really started considering her husband as an issue as well, and they ended up getting diagnosed with dual factor infertility, and they did some extra testing. And I just wonder why it wasn't done in the beginning. But every clinic is different, every doctor behaves different, and they do.
It's very painful when we hear these stories, those couples day in and day out. It's heartbreaking, because with male factor, the technology is remarkable. We've been blessed to practice in a period where we can take an individual sperm and inject it into an individual egg. So I don't care whether you need millions, or we have excellent technology, but we can't compensate for a woman's fertility status, overcome aging eggs. And when you hear that someone for a year only to find out that this is obstructed and he has no sperm, but he's making sperm in the testicle, that year is valuable, and we need to let couples know that it's not in their best interest to delay the of the male.
You guys mentioned earlier that it's always been sort of or marketed. A lot of clinics market the women um, in the situation and not marketing both the man and the woman or however the sexual orientation of the couple is. Why do you believe that it's been that way? Is it because we do bear the children and that we carry the children? Why do you guys think that we're always marketed more than the men?
Yeah, I think there's several different reasons. I mean, the way fertility centers were traditionally set up, they were set up by reproductive endocrinologists. And it was only recently that some of them really began to embrace the role of the male. And RMA is large, obviously one of them, which has been absolutely fantastic in New York and other areas. But the other aspect of this is that this has been seen sociologically as a woman's role, to bear children. And obviously it takes two to tango, by the way. It really takes a male and a female to accomplish this process. And now more and more males want to be involved in this process. And really, the burden's been really resting on the shoulders of the women, and which is really unfair to women. So it's interesting, the irony of all this is, by bypassing and neglecting the male, the women's have actually paid the price for this. And so both Natan and I are male fertility specialists, and we work exclusively with males. By helping out the males, we're actually helping out the women, quite honestly.
Absolutely. Yes. As a collective. Yes, 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 yes.
Look,
I
I
love you
think
guys as part.
yeah. No, I would also add to that there's ego involved. There's the macho involved, and having a male question his manhood, um, really a burden or an obstacle that we want to tackle, which is, let's bring the testing a comfortable, convenient environment. Let's take the lessons that unfortunately, these last 2, 3 years have been horrific, and not out of the woods yet, but we're realizing that medicine can be technology through, telemedicine and home testing is available uh, to bring those, changes that were accelerated by the COVID pandemic to help getting the diagnosis and assessment of the male early on. So there are a lot of reasons why this is a good time for this to succeed.
Right. As kind of Natan alluded to earlier, male infertility is not an issue of their virility. It's not an issue of their masculinity. It's truly a medical problem, and let's address it as such.
I want to tell you guys about Infertile Teas. Infertile Teas was created by Marilyn Gomez, who is an IVF survivor, mom to her one and only. Infertile Teas sells graphic teas made with the silent sufferer and infertility warrior in mind. Their graphic teas, hats, socks, masks, and a plethora of other goods are created and curated with you in mind to tell your story your own way. You guys, I really love Infertile Teas because the quality of the shirts are fan freaking tastic. They're soft and they feel great against your skin. The designs are very beautiful. Marilyn designs all of the graphics herself, and she also draws those graphics. So she's an all around creative badass, you guys. To check out Infertile Teas. And when you do, when you find that special item that showcases you while also advocating for infertility and or miscarriage awareness, use code IAM15 to get a discount on your purchase. You guys will not regret it. Check out infertilities.com for your infertility advocacy awareness products.
Yeah, I'm so glad you said that, Dr. Barrett, because I don't think that many people in the past have viewed it that way, obviously, because you guys wouldn't have created the platform. You wouldn't have seen the need to create it, you know? And so I just really love that. And I'm definitely going to have to keep that in the back of my mind and think of you guys when I'm speaking to people when they're asking for resources. And that's why I'm so glad that you guys are here so that I can present the resource to eyes that may not have come into contact with it yet. And so you guys speak a lot about, from what I've seen on your websites, individually and collectively, about just the couple and making sure that the care is done um, efficiently. Honestly, I think that's the bottom line of it, and it's not really that complicated. You know, it's just making sure that we thoroughly inspect the whole situation is what I'm hearing a lot from you guys, and when you're speaking. And so when you began to see the need for the male partner in a hetero relationship, is one way to look at it. When did you guys begin to see the gap? Or, you know, because when we're creating something new, we always looking for what's missing, right?
Yeah, I think because Natan and I have been in this space for a long time, we've always known it. We've always known it, and as you said, technology really has allowed us to get the message out and say, hey, let's address this issue. Let's help males. Quite honestly, not just in a heterosexual relationship, but those in the LGBTQ community as well, who have the right and the desire to have their own families as well. And so it's really become our passions to say, hey, let's make a difference. Let's change things so that we can give people the best chance for success.
And I think what you, Monique, is really important is yes, we can talk in the abstract, right? And for not being able to conceive, but at the end of the day, what's going on in your specific case? What are the facts that's important for you to make the right decisions for your achieved? And like anything else, if you are told try for 6 months and come back, everything looks fine, may not be the case. And why not get the data, personalize individuals going on couple so that you can make the right decisions that, that are important for you. One of the things that I always say to couples, very often they look at each month as its own event. And we were not successful, and let's try again next month. And I said, well, why don't we take and find out what the data is and what is your 6-month plan? Okay, what are you going to do each month so that you increase your chance to achieve a pregnancy and a healthy pregnancy? And once people a perspective of what is my 6-month plan or my 1-year plan, obviously getting the data is important to create that plan. And there's a shift there where diagnostics and testing isn't something you want to push off.
Do you see many cases that are just as complicated as women's cases of infertility? I always wonder if it's easier to treat some aspects of male infertility as opposed to female factor infertility.
Yeah, well, it's definitely easier to assess the male. Doing a semen analysis is really very, very simple. It's relatively inexpensive, and now we have the technology to be able to do that at home really in a private and comfortable environment. And so we feel that that'll make a big difference. And you're right. There, some of the cases that we see are very, very simple and straightforward, but other are quite complicated. Males who've been exposed to chemotherapy and didn't bank sperm beforehand, people with genetic issues. And there's people, it's really interesting. Some of the factors that influence male fertility status are really quite simple. Like just lifestyle and behavioral issues can have a huge impact on these things. And so, when I tell people, I say, look, if you want to be a father, listen to your mother. And they go like, what are you talking about? And they said, when you're growing up, your mom said, don't smoke, don't drink too much, don't do drugs, eat right, don't get overweight. All those issues can really significantly impact a male's fertility status.
I think that one of the things that has been also an issue is that the semen analysis, which is now simplified and made more through home testing and is still not tests to interpret. And so, there are many couples that come into my office panicked and stressed for weeks at a time to have the opportunity to see us because there aren't that many of us. Okay. And the analysis was really almost fairly, but there was a lack of expertise in interpreting the many into a semen analysis. And so that has often been, there's been in medicine, there's been a reluctance to do a test that might be outside. So Project AIM is not only to get the test, but how to interpret it, how to understand it, what step that we need to do to optimize or understand where the problem is from. And it's important to know that sometimes we don't have an answer, but very often, and it could be genetics and it could be hormones, and people are taking testosterone or people have poor lifestyle choices, but we need to get into the game. But the first step is to do the test and have it analyzed and interpreted by someone who understands the nuances and the complexity of a semen analysis.
It's really interesting as we go around and educate physicians about Project AIM. It's really been shocking that a lot of gynecologists won't order a semen analysis because they don't want to have to deal with the guy and have that discussion because it's not in their comfort zone. It just isn't. And I said, look, we'll take care of that aspect for you. We will actually communicate the results to the individual male and explain the implications and potential interventions that we can make together to improve it. And I had, one gynecologist come up and gave me a big hug. Said, oh my gosh, Barrett, thank you. This is like Christmas in July. So thank you for doing this because I hate making those semen analysis calls when they're abnormal. When they're normal, it's really easy. Hey, there's not an issue. But when it's abnormal, it's not in my comfort zone to understand the complexity and the implications of what a semen analysis. So Natan and I are really trying together say, hey, let's reach out to these people, make it easy get the semen analysis, make it easy to interpret the semen analysis and understand what the implications are.
Yes, I love that. And I think that is going to be one of the biggest impacts you guys have in collaborating with different facilities and clinics and working with other doctors for sure. Dr. Natan, were you going to say?
It's also important to educate that when you do a semen analysis and it's abnormal, right? That's just the first step. Both Barrett and I, come in thinking everything's fine and get diagnosed with testicular. Okay. And the only thing that triggered that was the fact that there was an abnormality on the semen analysis. The majority of testicular cancer comes from the cells that make sperm. So there's an increased risk in men with infertility to have testicular cancer.
Interesting.
The causes that we look for are genetic causes. And I can count is very low. The male is distraught. He smoking pot during college. He's ruined his chances of having kids. Post choices that he made a month ago. And all of a sudden, the test comes back as indicating the reason for his male. And we can't do anything about genetic causes, but there's a tremendous amount of relief. The couple's dynamic is changed dramatically because she doesn't blame him. There is no blame to go around. The cards he was dealt with, these are the genetics he was born with. And now the question is, what can we do to move on?
Yeah, that's a really great point. You guys are really good at what you do. Just from talking to you for a few minutes, I can tell. I can tell. Nothing apart from all the accolades, right, and all the successes in your research papers and such. So that's what I wanted to move into, as well as with all you guys' research, and then creating this AIM platform and collaboration to work with other doctors. And I love that it's creating an even wider network in the reproductive care industry. And doctors, you guys like to network with each other, with one another anyway, but I feel like this will be a lot different, and the impact that you will have, and the way in which it could reach various clinics all over the nation, and hopefully globally, I assume, is the goal. And so, do you guys plan on taking the data that you receive in collaboration with other clinics and somehow, what's the word I'm looking for, creating or getting, well, it's one of the reasons for your project AIM is getting better and a better understanding of male infertility and how you can help treat those patients.
Yeah, absolutely. I mean, there's no doubt that the kind of initial goals are right to raise awareness, give people access to expert male fertility care, which we perform, but in the long term, not only do we want to shift the burden from the women to both partners in this situation, but we have a tremendous database that is going to allow us to develop really new and innovative treatments, and have a greater understanding in the future for sure.
What I'm also seeing is there's been a shift in terms of how couples plan their family building goals. And if we are able to get the male evaluated sooner and then optimize the treatment plan, um, I see a lot of couples who basically say, well, the woman is 37, they want to have two kids, and there's a male, and we didn't waste their time, for over, for 6 months to. And what they do is they say, okay, let's create the family now. Let's use the technologies to make sure that those embryos are quickly. It's now really something that is very commonly done. Because now a 37-year-old woman's eggs with fertility can create two or three genetically normal embryos. Okay. The success of a pregnancy is markedly improved with the transfer of just one at a time to minimize multiples. And all of a sudden, there is no expiration date on those embryos. So when she's 40 or 41, she has embryos that were created with her eggs at the age of 37, and that can make the difference between success and a family.
Are you all hoping to encourage or inspire more up and coming doctors or those who are already in the reproductive care to get more education on the male side? Is that one of the things that you guys are hoping to do as well?
Yeah, there's no doubt that it's interesting because medicine has become sufficiently complicated, and time is always a factor, that everybody's busy, and it's quite honestly, it's hard to keep up with your own area of specialization. I can't expect a female fertility specialist, a reproductive endocrinologist, to understand all the nuances on the male side as well. And so, we want them to, yes, we do want them to educate themselves about that. And we plan on educating them, but they also make them aware that, hey, we're available to help them, so we can really make it easy, make their lives easier. Our goal is not to make it more difficult for the other doctors. It's to provide a service that'll relieve them of some of their workload, quite honestly.
How did you guys
Collaboration. Yeah,
Right, exactly, exactly. And so how
it's a
did you guys come
collaboration.
into collaborating with one another on the project and spreading awareness and everything that goes into creating the platform? How did you guys come together and bring it and make it, I guess, shook hands?
you, you know, um, we've been kind of designing a Project AIM and thinking about how we can reach out to more people. And I've known Natan for many years, and it was like a natural. He's in a really unique position that he's embedded in RMA in New York, and he's really very special in that he's incredibly qualified, knowledgeable. Obviously, you could tell by his comments, incredibly skilled and caring individual. So it was really natural for us to reach out to Natan and say, "Hey, is this something that you think would be you'd be interested in working in?"
Well, thank you. I think that the kudos go to Barrett and Pam, and the window of the pandemic and accelerating work, you know, needed and gaps identified and solutions that work, and just moving forward with it full force. And for RMA to be in environment, and I work with over 15 reproductive endocrinologists focused on the female, and the collaboration is such that we want to be able to make their successes, easier or more, and help the process that bring the technology that they have available. And also, I think what's important is,
If you guys have noticed this, but it seems like that's what people are jumping for. They're like bypassing IUIs. They're bypassing much lesser invasive forms of treatment to go straight into IVF. And I don't know if it's because of time, because time is such a factor, especially when us women get to a certain age, and we get impatient. We just don't want to wait. So
Right, but what we find is that when we evaluate the male early in the process, that we can make the process easier, more efficient, less invasive, less costly, not just to the individual, but to the healthcare system, by addressing the male factor. Because if there's no female issue and there's a potentially reversible male factor, and we find that about 70% of the time we can actually improve a male's fertility status, is that we can make it easier for these couples. And this is really an amazing thing when you think of the the size of the market, from the number of dollars that are spent on care and healthcare in the United States right now. We can significantly impact that as well, for sure.
as
yeah.
yeah, the anxiety
Mhm.
that a woman has is very much right. So if she's now starting the process and we identify a factor at month 1 or 2, there's more still here for them to try naturally optimize things. But if they, as a couple, after 6-12 months of trying, all whatever we can do to optimize or improve things isn't relevant to 12 months have passed. So that's getting the data important.
I'm a testament to that in my 6 years before getting diagnosed and going through the motions. Oh my gosh, before having my son, I was diagnosed with infertility at 29. And yeah, it's a whirlwind. So I always appreciate the work that you guys do in reproductive care and doctors in general, but especially for reproductive care, because I wouldn't have my son without doctors like you guys. So again, I appreciate you guys for coming on. Please tell us how we can get in touch with you all to be collaborative or be a patient of you all. And I'll give you guys the floor back to state your individual and collective platforms for those reasons.
Yeah, so our entity is called Posterity Health, and we operate in 26 states, all the major states with major populations. Right now, we want to expand even further. But if you find us on posterityhealth.com, and we realize that telehealth really allows us to do the majority of the work remotely. And so even if you're not in one of our locations where we have a clinical office, we find that 90% of our care we can actually deliver through telehealth, which is shocking. And that's what kind of inspired us to create Posterity Health. And we learned this through COVID. So, well, all of us hate COVID, believe me,
Exactly.
me included. I will tell you that that's what really gave me the idea to really start Posterity Health, was that I didn't really want to neglect my patients when COVID hit and we had to shut down our offices.
Right.
Those who are just starting their evaluation and treatment, those who are in the middle, and those who are trying to get across the finish line. And so I start begrudgingly, I began doing telehealth and thinking that it was going to be really difficult to communicate and connect with an individual through telehealth. And the reality is became much better and easier because one, it was more efficient. The people didn't have to drive across town and find a place to park in the office.
Exactly.
They didn't have to take extra time off from work, and it was much easier and more comfortable for the males to talk to me from the privacy and comfort of their own home as well, which made a huge difference. And the majority of the time, their female partner was there as well, which also provided really make it a much more useful conversation. And because when we were treating this as a couple as opposed to an isolated male or an isolated female. And so that's how we kind of got the idea of starting Posterity Health, was through COVID. So while COVID has been a struggle for all of us, and will continue to be to some degree for quite a while longer, yeah, it's really, there have been some benefits from that, and this is the one of them.
Look, I think that Project AIM is a real unique initiative. It's really a wonderful opportunity for reproductive medical associates of New York, the IVF facility that I've been fortunately engaged with for over 2 decades, to the next generation of technologies and access to care, and highlighting and focusing on the male. And I think just AIM, Posterity Health, RMA of New York will get to get started. And I encourage to kind of, let's get the men engaged. Let's get them, to be collaborative and function as a partner, and set the tone for the future in terms of how. And we're here to help and bring science to it in an efficient, calm, threatening fashion.
Yeah, it's really interesting. Well, it turns out that actually getting treated by a male fertility specialist with the evaluation is actually pretty easy, because the things that we do are relatively simple, in terms of intervention. Uh, we, we most men only require either lifestyle and behavioral changes or medical treatment. It's very less, about 10% actually require some kind of surgical procedure. So we can make a big difference relatively easily, in not just this a male's lives, but in this couple's life, right?
Yeah. Yeah.
And
And I
and
love
the
that.
last thing
Yeah.
that's I think important as well is, it's not just about the male being able to help initiate a. Okay, what we're realizing right now is lifestyle choices, obesity, um, exposure to toxins, not only affects to initiate a pregnancy, but the health of the pregnancy, and miscarriages, and diseases that might affect the child. Not only, we need to get the men to appreciate that now is not just getting someone pregnant, creating a child where the responsibility of that child is life, and the health of the
Mhm.
child is dependent on your health right now.
Mm. I'm so glad you said that, Dr.
Yeah.
Bar-Chama. I'm glad you said that, and I have said something very similar to men in conversations when they ask me about my fertility and things like that. And I think we do forget about that one small aspect, that it takes healthy sperm to create healthy and viable pregnancies as well as healthy eggs, right? It's the collective. Everything works together again.
Right. Correct. It's interesting because when a couple's able to conceive, whether naturally or through IVF, and not maintain the pregnancy, so there's multiple miscarriages, it's a devastating process. It's a devastating process, and the women feel that, I guess, their fault. Again, they kind of really feel the burden of this emotionally. It's incredible burden to have multiple miscarriages. And it turns out that in a significant number of those cases, it's not a female factor at all, it's a male factor. And so we have developed this program, we call it a recurrent pregnancy loss, or RPL consult, where we evaluate the male and really try to optimize the male, because it's not just the presence of sperm that important, but the quality is really important as well. And so when people are experiencing these situations, which are just devastating, have the male evaluated as well, because it can make a big difference in the long-term success here.
Yes, I'm so glad you guys are saying all these great and fantastic things as reminders to all of our friends listening to this episode, and whether they've been on the path to parenthood for many years or just getting started, all great reminders and a lot of knowledge and education that you guys have put into this 35-minute episode. This is fantastic, and I'm so glad that we were able to do this morning, and I'm so thankful to you guys for getting up early for us and speaking to us about your Project AIM and just male factor infertility as a whole. I cannot say thank you guys enough. Thank you so much for being here this morning.
Well, thank you for
Thank you for
doing what
having
you
us.
do. It's helping us get the word out is really important.
Yes, yes, it is always important. And I'm here for you guys. So anytime you want to come back on, I'm here. If you're doing something new, I'm here. And then hopefully I'll get some responses too. And maybe I can shoot those people to you guys directly into your inboxes and to your secretaries and those who help you with your individual practice and collective. And so thank you, friends, for tuning in to another episode of Infertility and Me Podcast. You guys know where to find me on Instagram. Peace and blessings, you guys. Thank you.